Most commonly, signs that your Suboxone dose might be too low are cravings or urges to use opioids, or the more classic withdrawal symptoms like anxiety, restlessness, sweating and goosebumps, runny nose and eyes tearing up, yawning, hot flashes or chills, aches and pains, nausea, vomiting, and of course, diarrhea. If you're experiencing overwhelming cravings and you're seriously considering returning to using opioids, please reach out to your Suboxone prescriber. At Bicycle Health, it's as simple as sending a message in the Bicycle Health application's chat room to request to see your Suboxone prescriber sooner, and an appointment with the provider will be scheduled pretty quickly. If it's not that urgent, I would still talk to your Suboxone prescriber at your next appointment. You don't want to be underdosed and experience cravings or withdrawal symptoms, because this can put you at risk of going back to using opioids. And as people who treat addiction, we want to give you the best chance at recovery from opioid addiction. On top of that, you don't want to be experiencing withdrawal symptoms impacting your sleep, your ability to work or go to school, or just do the things that matter to you. I sometimes find that a person's ego or the critical voice in their head gets in the way of dosing Suboxone appropriately. There might be a little bit of stigma that a part of you is harboring around taking Suboxone. So maybe you don't want to be taking what you might actually need and you'd rather grit your teeth than white knuckle it. Or you might just be too eager to get off of the Suboxone when in fact you just might not be ready, as your opioid receptors haven't physically adjusted enough, or you might still need to work on other aspects of your recovery. Regardless, a key part of recovery is accepting reality. The reality that opioid addiction has hijacked your brain, and it's going to take more than just willpower to recover. And remember, step 1 of the 12 steps is admitting powerlessness. Another part of this is that people are worried about taking too much Suboxone, and even providers are concerned about the risk of overdose, especially when Suboxone is combined with alcohol or benzodiazepines. And this is true. There is a concern for taking too much. But if you're experiencing cravings or opioid withdrawal symptoms, increasing your Suboxone dose will not make you overdose if it's titrated appropriately under medical supervision. So if you think your Suboxone dose is too low, please talk to your Suboxone prescriber.